Hello, everybody. This is Dr. Hurtig with Chiropractic. I want to talk to you about the most common CrossFit injuries that we see. Now, a lot of my patients know that I was a CrossFit coach for about 4 years, okay? And so with being through a coach and also coming into becoming a doctor and treating these symptoms, these are the most common things that I see about where people injure themselves. Number one, by far, deadlifts, okay? I tell my patients all the time, stop doing deadlifts. And the reason for it is because the risk is not worth the reward. There are other things that access those same muscle groups that you can do that have the potential of not hurting you like deadlifts can, especially with CrossFit about how many deadlifts and such the heavy weight for people who don't lift as properly as they could. And the reason for it is this. So a normal deadlift stance is here, okay? But what happens is whenever you get here to lifting that weight, what starts to happen is you bend here. And you get this pivot, you start to kind of have like a butt wink right here into this area, and that's putting so much pressure in this L5 S1 disc space. Now that's the most common place for people in order to experience low back pain. And what I'm talking about is here. This is the L5 vertebrae, and this is starting of the sacrum, or S1. This disc space right here, what happens is whenever you're bending forward and lifting that area, it's causing a lot of rotation and tension into this area, which puts a lot of pressure on the front of this disc space here, putting pressure on that nerve, causing pain. The next thing that I see is going to be back squats, okay? Especially with high reps in a lot of weight. The reason for that is this, kind of the same thing with the deadlifts. Whenever you're here and you're holding this position and you're squatting down, what's happening is people are going all the way down and then they have a butt wink. So look at the difference. Improper, but proper is here. Stop, but don't allow that last couple of degrees where the butt shakes down, okay? Because that butt wink right there is gonna cause more pressure into that L5 S1 disc space. Now, if this happens to you, it's not the end of the world. This is something that we deal with all the time. Give us a call here at Chiropractic. We can get you back into the gym, back where you wanna be, okay?